Hi, I'm Dr. Bradley Peterson. I'm at the University of Southern California and Children's Hospital, Los Angeles. There, I'm Chief of Child and Adolescent Psychiatry at both institutions, as well as co-director of the Behavioral Health Institute at CHLA. I'm also Vice Chair for Research in the Department of Psychiatry at USC. The good news is that kids get better. Kids who have anxiety disorders, they get better with treatment. And our study was designed to answer several questions. One is it better to start with cognitive behavioral therapy or medication therapy? And in this case, medication was fluoxetine, or more commonly known as Prozac. And in answering that question, they came out pretty comparable head to head. I mean, there was a little bit of advantage for one over the other, but not really meaningful clinically. But kids got substantially better over the 6 months of treatment uh, on either of those treatments. Another question that it was designed to answer is that after 3 months of initial treatment, is it better to continue what you started with or add the other treatment modality if you need more help? And most kids in the study, the vast majority, needed more help. And there, the answer was also they're pretty comparable. You can either stick with what you initially started with, or you can go to combination treatment. There was some slight advantage to going to combination treatment, however. Um, and then there were other nuances to this, which is if you think about it carefully, there are different sequences that any kid could have in the study. You could start with CBT and continue it. You could start with medicine and continue it. Or you could start with CBT and go to combination, or start with medication and go to combination. And there's where we did find pretty substantial differences. And it turned out, somewhat unexpectedly, first of all, combination treatment is more helpful on average, but it was kind of how you got to combination treatment. It was better if you started with CBT and then went to combination treatment. And and that is a sizable difference, a clinically meaningful difference. We also found, not in the published study, but in the analyses we've been doing since then for the final report to our funder, that these findings that I just described essentially uh, became accentuated after the 24-week trial, the 6-month study. So over the ensuing year, the treatments did begin to separate more and more. And so that particular sequence of going from CBT to combination treatment did seem to be the best overall if you take all kids, all comers. So the bottom line of that is that um, for families and kids and clinicians, the two treatment modalities and their combination are all valuable. They're all helpful. Some kids and some families may prefer one over the other. Some prefer medication over CBT. Some prefer CBT over medication. And really, I think families should be supported in that decision because the findings suggest that both are comparably helpful on average. I think the other kind of take-home message is that if kids do start with CBT, if they're still struggling after 3 months or so, the addition of medication can really boost the effects. And that's very important and helpful. There were some other findings that I think really help families and clinicians think about what medications to begin with. So, for example, we found that medication alone without CBT, so medication and sticking with it throughout the 6 months, it dramatically helped white non-Hispanic kids much more than it did minoritized youth. We weren't expecting that, but it was a very powerful finding where they improved about 3 times more than if they went with cognitive behavioral therapy, for example. Um, so it suggests that there may be some characteristics of some kids that we're going to learn about like this, like race and ethnicity, that may guide us toward one of the treatments rather than another to provide the best chances of improving with anxiety.